Shalom, family. Just drop that down so it's not. All right, man, we are headed into our first heat wave starting tomorrow, and it's going to go on for 5 long, miserable, hot, smoldering days. And boy, I'm not looking forward to it. It just means I got to get up and do everything outside extra early. Okay. So we are going to go over this article about when it comes down to drugs, which babies are more prone to dying the most. And that is based on who the mother is. And I want to thank one of my subscribers, Nicholas D. Vaughn, for sending this story. Thank you very much for this one. So I'm going to go ahead and share my screen and we're going to get into this. Let's see here. Okay, here we go. Please give me a 1 if you can see my screen. Please give me a 1. Shalom, family. Shalom to everybody in the chat. Shalom, shalom. Okay, wonderful. All right, so let's get into this story, everybody. Hello. Shalom, King Obadiah, and everybody that I see, just so many of you. Okay, so this story just came out on June 3rd, 2021. Babies born to white mothers are almost 4 times more likely to be killed by drugs than those born to Black and Hispanic women, CDC report finds. And you know what? This is very true. If you've been with me over the past few years and the drug stories I did on opioids, you would see a lot of white parents, or it would be the mother and a boyfriend. They would be all strung up and high, and the children would, in some cases, be high too. Now, a couple of them killed their own kids, giving their kids drugs, and the child dies. I did quite a few stories on white babies dying because the mother caused them to overdose. And a couple of them died from fentanyl. Just touching fentanyl, you can have an overdose and you could possibly die. So I'm not surprised. And when I also reflect back during the time I was in school, everybody, the white kids did way more drugs than the Black kids. In fact, they used to even drink alcohol at much higher levels than the Black children. I'm not saying none in the Black community touch alcohol. Of course they did, but not at the same rate they were drinking. And then when I got to college, shoot, they could drink us all. They could drink the entire Black community under the table. He used to drink and booze and drugs so much, it wasn't even funny. All right. White mothers in the U.S. are nearly 4 times more likely to have an infant death involving drugs, a new report published on Thursday found. Between 2015 and 2017, 448 babies had a death in which drugs such as cocaine, methamphetamines, opioids, naloxone, and cannabis were involved, according to the Center for Disease Control and Prevention. National Center for Health Statistics. So, of those infant deaths, about 60% were children of Caucasian women. So they accounted for, and these were mothers that were drug addicts. And they have a 60% chance of dying from drugs if they have a white mother. Infants. Okay? 60% chance. This figure is much higher than roughly 20% of babies who were born to Black mothers and to Hispanic mothers. Death rate from drug overdoses exponentially rise when it was in the US. So it was tripping at 6.1 deaths per 100,000, 1999, and 21.7 deaths per 100,000 in 2017. And we know the opioid deaths, even to this very day, are off the charts, but they have literally buried it and make you believe that nothing is going on in their community. They always had this opioid drug problem. What is this, about 23 years now? This is definitely topped the crack epidemic. Crack epidemic did not last this long. Okay, so they even topped that and far outpaced the deaths during that time as well. So they are saying that nearly 20, okay, let me just go down. I read that part. For the study, the NCHS team looked at death certificates in the National Vital Statistics System. So their research was between 2015 and 2017. Drug-involved deaths are defined as deaths that occurred during a drug involvement as either an underlying or contributing cause of death, the author wrote. Among infants, this could occur due to accidental or unintentional ingestion of selected prescription, illicit, or non-medical use drugs, maternal use of drugs, and other cases for which drugs were associated with death. So, topping the chart of drugs that have killed infants in this country, number one is methamphetamines. Now, Black people don't do meth at the same rate as white people do. They do way more meth than we do. So that is the number one cause of death in infants. No specific drug mentioned. 111. Opioids, the third leading cause. Cocaine, fourth. Opioid treatment, something like methadone that they use to try to treat opioid addicts. Cannabis, 24. Other stimulus. Okay, so meth is like the leading cause of infant deaths. Now, you got to think about it. Infants can't go out and purchase meth. So this just proves that these women are doing drugs all around their babies and everything. That's proof. Okay? There's no way an infant can get access to your drugs like that. You're doing drugs around that child. The most common drug listed on the death certificates was methamphetamines, which had 154 mentions. The next most common were opioids, including fentanyl, heroin, hydrocodone, methadone, morphine, and oxycodone, with 80 mentions, followed by cocaine with 78 mentions. And when they say mentions, that's what's listed on the death certificate. When it came to a breakdown by race, the team found that 60.4% of babies who died were born to white mothers. That's 3.5 times greater than the 17.6% for Black mothers and 16.7% for Hispanic women. So just looking at those percentages for Blacks and Hispanics, it is a very low occurrence for infants to die by something related to drugs. But for white babies, it is really high. 60.4%, that's pretty high. Okay, so more than two-thirds, 67.2% of infants were born to women with a high school diploma or less, and 2.9 were born to women with a higher education. So, of these babies that died, most of them died with white mothers that had a high school education or less. Mothers of babies who died due to drug involvement were also more likely to be less educated. About two-thirds, 67.2% of infants who died were born to mothers with a high school degree or less. So these white women that ultimately killed their babies by, having access to drugs, they didn't have that much education. Okay, comparatively, just 2.9% of babies who passed away were born to mothers with a bachelor's degree or higher. So it just means that if you got education beyond high school, the chances of your baby dying are far less. Among the infants, researchers found that infants who died from drug related causes were more likely to be born prematurely or have a low birth weight. Linking birth and death certificate records provide additional key information on mothers and their babies, increasing understanding of these deaths, the author wrote. The findings in the report may help identify risk factors for drug involved infant deaths and inform efforts to reduce their preventable deaths. So, ladies and gentlemen, you know what this means? On top of already having a low birth rate, the babies that are born to these white mothers that are doing drugs, they're making things worse because now their infants are dying at 67.4% of the time when they have a white mother that's a drug user. So, on top of your low birth rate, you got these mothers that are virtually killing their babies with the drugs. But we know you're going to call it accidental deaths and this and that, and nobody's accountable for what happened. We know how you roll. Plain and simple. We know how you roll. That's interesting, but I'm glad they put that out there. You remember for years they tried to call Black parents bad parents. How can we be bad parents when we raised your kids? Go back and look at the history of that history you're trying to bury. Black women raised your brats that you didn't want to be bothered with. Many of them did. And they were wet nurses for your children. You were too trifling to breastfeed your own babies and you hand them over to Black women to do it. So how the hell did we go from that to being bad parents? Well, the way I see it, y'all got a lot of work to do in your own community. You got decades and decades long opioid problems. And now you got all these women that are on drugs that are virtually killing their babies. So, and don't look in our backyard. You clean up yours. Clean up your backyard because you got plenty of junk in it. Yeah. Mm-hmm. And you heard the numbers for the Black community, 17%. Ain't hard. Those kind of deaths with our infants it's not happening in big numbers. Not like theirs, but in our community, that mess ain't happening in no big numbers. And you know what, y'all? They call these accidental deaths. How many of them are really accidental? How they could be giving these babies drugs just to get rid of them. They don't want them. I mean, we have no way of knowing. I don't think they're all accidental. That's all I'm saying. I don't think all of those infant deaths are accidental. Yeah, you know what? That's a good question, Michelle Harvey. How many go to jail for murder and neglect when they Esau people's baby died? You're absolutely right. Remember, they during the crack epidemic, they were putting black women in jail if the baby died in the womb and they were crack addicts. They went to jail for murder. Do y'all remember that? They sure enough did that to black women. But now that we're in the day and age of opioids, I notice they're not doing that to their addicts. They're not doing that. That's why I don't pay attention to them when they come and make an arrest in the black community and talk about they found drugs. Oh, you got a lot of nerve. You got a lot of nerve. I bet you there's more drugs in the white community than there are in the black community. I'm willing to bet every dime in my wallet that that is the case. If they want to do a drug raid, they can do one on their own community. That's where the drugs really are. Shoot, their kids be stealing their weapons and running out in the street and trading the weapon for drugs. That's why there's so many illegal guns in the black community, because they bring the guns in the community to get drugs. Mm-hmm. Shoot, on the crack epidemic alone, this government owes us reparations, because they were the ones that came in with the drugs and sabotaged the entire community. But yeah, I definitely remember how they had that all structured, where if a black woman was carrying a baby and the baby died because she was doing crack, she got thrown in jail for murder. But yeah, you ain't going to read about them doing that to their women. Even if they're wrong as two left feet, they're not going to do that to their women. Yeah, well, I mean, so can we say they don't care about their kids? Would it be fair if we said that? Isn't that what they tried to say also during the crack epidemic? We didn't care about our kids. And yeah, I remember all the stuff they said. I remember all of it. And I remember sitting around them at work and they said all those crack addicts belong in jail. But I notice now that we're in the day and age of opioids, I don't hear them having their mouth wide open talking about the opioid addicts need to go to jail. And many of them commit crimes to get their drugs. Because, see, that's one thing about being a drug addict in general. It doesn't matter what race you are. Eventually, you're going to run out of money. And when you run out of money because you're doing so much drugs, you're going to start robbing people in stores and in business. You're going to be just robbing place because you're desperate for the drug. You don't care. Mm-hmm. And it's the mother's fault. I mean, how can an infant go out and get drugs? So that's 100% the mother's fault, right? I mean, look, they're trying to tell you the story in a way without trying to put the blame on the mother, but it is the mother's fault. You brought the drugs around the infant. And like I said, the fact that it's that high tells you all of these women, or the majority of them, I should say, are doing these drugs right in front of those babies, with the baby right there in the room. They're doing the drugs. Might even have the baby sitting on their lap while they're doing the drug. But the baby is definitely in close proximity of the mother in order for them to have the drugs in their system. And who put the drugs in the system? Some of those babies that died weren't even a month old. So how did the baby have access to the drugs? That's 100% the mother. That's 100% the mother. But they're very careful in how they're saying, oh, well, they died. Yeah, they died. And who put those drugs in the baby's system? That baby didn't do that themselves. The mother did that. Mm-hmm. So who belongs in jail now? But you can't expect them to do the right thing in this corrupt system. This system is so corrupt, it can't be fixed. It's got to be done away with. There's no reforming or fixing or anything. This whole system must go. You cannot fix all of this corruption for 500 years. You can't just suddenly fix it now. It is too far gone. It can't be fixed. Yeah, and I mean, and who's to say they didn't give drugs to the baby just to shut the baby up? Because you know how some kids are colicky and they cry a lot. And you don't know, some of them babies could have been like that and they just couldn't handle it no more. They thought maybe giving them drugs would help them relax and sleep. These people are crazy. We got psychotics running the place, y'all. That's why we got a bunch of psychopaths running the place. Mm-hmm. But you know what, y'all? Look at it this way. It's history repeating itself all over again. Who was the biggest killer to Black children during chattel slavery? Who was the biggest killer? Right? And now, who is the biggest killer of infants in this country? The same woman. The same woman, y'all. So why should you be shocked? This is history repeating itself. The biggest killer of children during chattel slavery is the biggest killer of children today. Nothing has changed. Nothing. So everybody, look like we're getting ready to have a pretty powerful electrical storm. We got black clouds in the sky and I'm hearing all these rumblings of thunder. So it's about to cut loose around here. But to me, this is not a good thing because we're going to have 90-degree days for the next 5 days in a row starting tomorrow. And this rainstorm is just going to add humidity. That's what it's going to do. So I'm not happy about this at all. But y'all, please, wherever you are, please enjoy the rest of your day. And we'll definitely come back and do this again real soon. Shalom, family.